Hi, welcome back to the North Texas Wealth Management webinar. I'm Mike Cruz, CEO. I'll be the host today, interviewing Tom Clark with the Social Security Administration. He worked there for 33 years. We're lucky to have him. He actually was the most published or a speaker with Social Security, over 6,000 speeches during his time there. He also received 2 citations from Social Security. That's their highest award, along with 4 others, and lots of recognition for being the expert in Social Security. And so since retirement, Tom's now a Social Security consultant, traveling all over the country, giving talks and speeches and answering questions about Social Security. We've worked with Tom for years at North Texas Wealth Management, and a lot of times when our clients have Social Security questions or challenges that are very complex and no one can seem to get the questions answered, we turn to Tom to help our clients get those answered. So, Tom, thanks for being here today. I really appreciate you joining me. Yeah,
glad to be here.
Yeah, so I want to start out with one of these questions. It's kind of funny because, I get this a lot, that people ask me like, oh yeah, what are all the changes going on with Social Security?
Yeah, I used to get that question a lot when I worked at Social Security, and Social Security hardly ever changes actually. Around the end of the year, about this time of the year, I used to get calls from organizations. They would say, we want you to come to our organization in January and talk about all the changes in Social Security. And my set answer was, well, I'll be glad to do that. You have to give me 5 seconds, because I'll say there's a 3% cost of living raise and nothing else changed, because that's the way it is.
Yeah.
So very seldom is there a change in Social Security.
Yeah. And I think maybe what people refer to as the full retirement age, right? So maybe when they first learned about Social Security benefits for retirement, the idea of when they could receive full benefits, that age has changed.
That has changed, but that law was passed 40 years ago, as you can see. Not a whole lot of change since then.
Yeah.
So the full retirement age gradually increasing from 65 to 67.
Okay.
People born in 1960 or later will be 67. If you're born a long time ago, it's 65, but if you're born before 1955, it's 66. If you're born between 55 through 59, it gradually goes up 2 months a year till it gets to 67.
Right. Okay, very good. So not a lot of change going on with Social Security, but it is one of those very complex, it depends on a lot of different factors, for when you draw retirement benefits. Can you talk about just kind of retirement benefits in general, and what are some of those considerations to maximize your benefits?
Sure, and retirement benefits at Social Security does have specific meaning. It's not just a generic term. When we're talking about Social Security, retirement benefits means a benefit we can receive based on our own work at Social Security, under Social Security. And we can draw that as early as age 62. If we're retired, there is a limit on our earnings till reach full retirement age.
And that's for everybody. Everybody can draw as early as 62.
That's right. Now, there is a limit on their earnings, so if they're still working full time, they might not be able to. Once a person reaches their full retirement age, there's no limit on their earnings, and so somebody could keep on working full time at that point and draw their full benefits. However, they do grow by 8% a year. These are called delayed retirement credits. From full retirement age to age 70, if you don't take a check, you get an extra benefit added to it for each month you didn't draw a check between full retirement age and 70. That over 12 months, that adds up to 8%. Now, don't wait past 70. But I get a lot of questions. I do some radio shows, and I find that radio hosts usually like to start out with one set question. The question they always ask me, I have to be ready to answer that, is what do you think the biggest mistake people make in Social Security? Sure. And my set answer is, I think they take it too early. I think a lot of people do not realize how long they're likely to live because the benefits are reduced if they take it before full retirement age. And a lot of people take it too early. If they're the average person, they'll draw a whole lot more total dollars by waiting until at least full retirement age. But not everybody should wait. That's the general idea is I think it's best to wait to full retirement age. But that doesn't mean everybody should wait in every situation. For example, if somebody was laid off in 2009 when their 401k was down 50%, it might have made sense to take an early Social Security check at 62 then rather than dip into your 401k when it's down.
Yeah, that's a great example.
Make a huge difference in how long that 401k would last if you take the money out when it's down like that. So there's different situations. I also think that maybe both members of the couple shouldn't wait, because we'll talk about widows benefits in a little bit, I'm sure, but once one member of the couple passes away, the survivor's down to that one higher check. And so it makes a lot of sense for the one with the higher benefit to wait as long as possible to maximize the check, the last survivable draw. I don't see a lot of sense in both people maximizing their checks.
Right.
Because as I said, you're down to that one higher check. So I like the strategy of the one with the lower benefit taking the benefit as early as possible, the one with the higher benefit waiting as long as possible. Of course, talking to their financial planner to see what's the best thing to do, because there are other finances are involved in that, of course.
Yeah, and we've seen that scenario quite a bit. And of course, that's something that we model and for our clients, so we can look at the cash flows and income streams and then outline that along with other income sources, maybe pensions or investment income, to try to maximize what you can draw for Social Security benefits.
But as far as the higher wage earner, for most people, with pensions having disappeared for most people, this is their only guaranteed lifetime income. To me, it makes sense to maximize the higher of those anyway by waiting as long as possible.
Right. And one thing we talk to our clients about is by maximizing the amount you'll receive, when you get those cost of living adjustments, it's a bigger dollar amount, right? So if you're getting a 3% cost of living adjustment, you want that benefit to be as high as possible, so 3% is more dollars.
Right, and that's surprising how much difference it makes. So somebody waited till 70 and say their check is $4,500 because they waited till 70. Well, 3% raise on $4,500 is more dollars than 3% raise on $3,500. And I've modeled that out, and it's surprising how much bigger that check gets, how much bigger that gap gets over somebody's lifetime.
Yeah. So I get this quite often that couples drawing benefits, they come back to me and they say, my spouse should be getting half of what I'm getting, and they deferred their benefit till age 70. But there's a lot of confusion of they're not really receiving half, or maybe they started their benefit at 62, and so they think, well, they're not getting half of what I'm receiving. Somebody started at 62, they waited till 70. Can you kind of help me clarify that?
Yeah, there's a lot of misinformation about Social Security, and one thing I say in my seminars quite often, a little joke, is that anything your brother-in-law is going to tell you on Thanksgiving Day about Social Security and Medicare after watching the Cowboys and eating turkey will be wrong. Anything your coworkers, neighbors tell you about Social Security will be wrong. Over 40 years in working in this area, I haven't found an exception to that yet. So there's a lot of misinformation. And that's one of the most common pieces of misinformation, because they always we usually say it this way, because generally the husband's a higher wage earner, so usually they say the wife gets half the husband's check. And it's actually, the spousal benefit's not based on check amounts, it's based on full retirement age amounts. So, for example, for the wife to be due, assuming the wife's a lower wage earner, for her to be due a higher check on his record, her full retirement age amount has to be less than half of his. So the check amounts don't matter. And when he's living, the spousal benefit's based on half his full retirement age amount, not half his check. So if he waits till 70, those extra credits he got by waiting, those aren't included in the spousal computation, still based on what he'd be receiving had he waited till had he taken it at full retirement age, not waited till 70.
Right.
Now, if he passes away, the widow does get those extra credits he got by waiting.
Yeah, and that is a big benefit to waiting. You can maximize your inflation plan. You can also maximize the survivorship benefits for your spouse. And of course, like you said, it's one of those incomes that's a lifetime income, and it can lower the requirements from what you're going to take from your investments. I
tell people all the time that when you're in your 60s, life insurance is very expensive, right? The cheapest insurance somebody in their 60s can buy for their spouse, if they're higher wage earner, is to wait till 70 to draw that benefit. That's the cheapest life insurance they can buy by just passing up the check for a few years, because you've guaranteed that guaranteed income adjusted for inflation is going to be higher for the widow.
That's right.
Who passed away first.
That's right. So somebody that is married, if they lose their spouse, the key is they keep the higher check. Right.
For example, let's say we have a husband and wife both drawing their Social Security. Say the husband's check is $2,500 a month and the wife's is $1,600 a month. If he passes away first, if she's full retirement age or older, her check would go up to exactly what his was. So, an example, go up to $2,500. If she wasn't yet full retirement age, it would go up to that higher amount, but reduced a little bit for each month that she's younger than that age. And also, while we're on that subject, this is one thing a lot of people don't realize, but widows and widowers have an option that does not apply if your spouse is living. If your spouse is living, you have to take your own retirement benefits first. But a widow or widower can take one benefit and let the other one keep on growing, file for it later. For example, let's say we have a widow and she's worked, but her deceased husband made more money. So the widow's benefits are higher than her own retirement benefits. Let's say she retires when she's 62. At that point, she'd have the option of taking her own lower benefit, reduced for being younger than full retirement age, receive that till full retirement age and switch over to unreduced widow's benefits for the rest of her life, or vice versa. If her own was higher, she could take the widow's first, delay her own. In that situation, her own would grow to 70 if she delayed it till then with those delayed retirement credits.
Yes.
So if we do have somebody watching, and surely we do, who's a widow or widower, if they're unmarried or didn't remarry before age 60, because then they can still get the widow's benefits, I strongly encourage them to contact Social Security and let them give them all their options and dollar figures and dates. They can tell them, if you take the lower benefit now, you'll take this much less by doing that, but you'll have this much more for the rest of your life when you switch over to the higher benefit.
That's a really important, when we work with folks that have lost a spouse, it's a really difficult time, and it's an even more difficult time to understand that strategy right there.
That's right.
And so, and we encourage them to, we model it and outline it and encourage them to meet with Social Security to go over these benefits as well. Talk to me a little bit about that. When can you do things online? Everybody wants you to, you call in and the first thing on the phone is, hey, go to our website and you don't have to call in, right?
Right.
When should they call and make an appointment versus?
Okay. Well, first of all, they can apply for all benefits online except widows and widowers benefits. And I want to make it clear that when we're talking about Social Security and I say widows, that includes widowers. The laws are exactly the same for men or women. And the one benefit you cannot apply for online is for widows benefits. And that's because since they have that option of taking one benefit and let the other one keep on growing, Social Security knows most people aren't even aware of that. And so they want to talk to them first to give them their options so they're making an informed decision about which benefit to take first. So that's the one that you can't file online. As far as filing for benefits, in most cases, I think it's best probably to file online because the Social Security offices are so busy these days.
Yeah.
But if somebody really needs to talk to somebody in person, maybe there's a communication issue or something, they can still call the 800 number first and make an appointment for an in-office interview, and they'll be in that waiting room with hundreds of people. At that appointment time, they'll come call them out of that waiting room so they don't have to wait behind everybody else. So if you need to go in for some issue, make that appointment first. You're not waiting behind everybody, because with the baby boomers reaching retirement age, there's a bunch of us. The numbers are incredible, how busy they are. About 15,000 people file for retirement benefits every day with them. 15,000
a day, wow.
That's just retirement benefits. That doesn't count the widow's applications, the spouse's applications, the children's applications.
Wow.
The 70+ thousand Social Security cards they issue every day, because this is a really big country, and Medicare entitlement. So they're extremely busy these days.
Yeah. Long lines, so make an appointment.
That's right.
Makes sense. So talking about retirement benefits, is there anything else before we kind of move on? I'd like to talk about disability benefits as well, but what else do we need to talk about with retirement?
Well, I think the issue of when to take the benefits is still a big one, and they really need to talk to somebody. I do personal consultations, or a financial advisor to make that decision, because I always say it's best to wait as long as possible, but that doesn't apply to everybody in every situation. Let me give you an example. People think of longevity wrongly when they think about Social Security. They say, well, if I don't have much longevity in my family, I ought to take the benefits early. That may be a case for the lower wage earner of the couple, but not for everybody, and this is why. I'll give you an example. I had a 63-year-old who had just retired. He had called me for a consultation. He had inherited a congenital heart defect. He had already outlived every male member of his family. No male member of his family had lived to be 63 even. He knew he wasn't likely to live more than 3 or 4 more years. His wife was 8 years younger than him. He was by far the higher wage earner. He was wondering, based on low longevity that he expected, should he go ahead and take a reduced benefit? Well, by him taking a reduced benefit, that would reduce what she would draw as a widow. And being 8 years younger, she might draw that benefit for 30 plus years, right? I did some computation with him. If he died after drawing benefit, if he took his benefits at 63, lived about 3 or 4 years and died, that lower benefit he would have got by doing that for the widow would have cost her over $200,000 in today's dollars over the course of her lifetime.
Right.
And so sometimes longevity works the other way. If somebody doesn't have longevity, if they're higher wage earner, that means maybe they shouldn't take a reduced benefit.
Yeah, that's right. That's right. Yeah, I like to tell, folks that I'm working with, there's no award at the end if you broke even on your Social Security
right.
benefit,
That's
right? And so, that may
point.
not be the goal. It may be
Yeah.
that you may be better off deferring because you need the additional cash flow that makes your retirement comfortable.
Right.
Or you may be better off with a strategy like that because you are trying to maximize the number of dollars you receive over your lifetime, and maybe that lessens the burden on your investments. So there's a lot of trade-offs that you can look at to make the decision of when to
People
start.
really get obsessed with, well, I'll break even. I'll live long enough to break even. And an advisor one time I was doing a seminar for had a good point. He said, you can play the odds is all you can do. Nobody's got a crystal ball that works.
Yep.
You play the odds. He said, really, what you don't need to be worried about is not, will I die before I break even? Will I die too soon? It's, will I live too long and outlive my savings?
Yeah.
That's more likely to happen. If you did live to be 98 years old and outlive your savings, wouldn't it be nice to have a $4,000 check coming in instead of a $3,000 check at that time?
Yeah, exactly. So getting more from benefits. So no, that's great. It's really helpful. So in looking at disability benefits, how serious of an issue is that? How many people draw a disability check?
It's incredible. In my opinion, disability is the most important part of Social Security, far more important than retirement benefits, because it's kind of human nature. We look forward to retirement, we plan for retirement, but it's human nature. We really don't think we're going to become disabled for retirement age. Unfortunately, it happens to a lot of people. 1 out of 4 workers, 25% of workers will become so disabled they actually receive Social Security disability before they reach retirement age.
Wow.
And that's very disabled. When Social Security says disabled, they really do mean disabled. For someone to receive disability from Social Security, they have to be so disabled they can't do any type of job that people do for a living that exists anywhere in the 50 states. So it's not a job somebody could do here, but they're able to do a job in Montana, they wouldn't meet that requirement. So very strict requirement. 25% of all workers meet that requirement. And the reason disability is more important is because they haven't had a lifetime to save for retirement when they become disabled at a younger age. And the most expensive thing a person can do in their lifetime is become disabled.
Sure.
Because their paycheck stops, but their expenses skyrocket at that point. And so in my opinion, disability is the most important part of Social Security. And a lot of information about disability too, because this is what common knowledge is, right?
Yeah.
And when it comes to Social Security, common knowledge is always wrong. But common knowledge about disability is they say nobody gets allowed disability unless they apply and get denied, appeal and get denied again, then appeal to the administrative law judge for a hearing. And actually, the majority of people who are drawing disability were allowed on the first application without any appeal. They didn't have to appeal at all. And one reason people get the opposite impression is because they're drawing their checks, it's no longer an issue with them, so they're not talking about it.
Okay.
But of the people, about 30% of the people who are drawing disability that were denied at first, and Social Security eventually says, yes, you are disabled after all, almost all of them would not have had to appeal if they'd just used something that sounds easy, but it's not so easy if you're the person with a disability. And that is tell Social Security why you can't work. Mm-hmm. You think it'd be automatic, right? Somebody becomes disabled, they apply for disability, Social Security asks you, why can't you work? And they're going to tell them. Actually, the opposite is automatic, because they've had a very traumatic thing happen to them. The experts say that becoming disabled for most people is the third most traumatic event that can happen to them in their lifetime. And so they're still in denial about how severe their disability is because it's so traumatic when they're applying with Social Security. And so they don't put down how severe it is on paper because they'd have to face up to how disabled they are, and that's very painful if they've been in denial about that. By the time they go through the hearing level, they've worked through that process, no longer in denial. And another mistake people make is they think the medical record is going to tell Social Security everything they need to know about whether they can work or not. And in very few cases that's true, but in most cases it's not that easy, because Social Security's making one decision only medically: can this person work? Doctors don't work for Social Security. Right. So they document the medical files for treatment purposes, not for work purposes. So in most cases, there's a lot of gaps as far as work in those medical records. The person needs to fill those gaps in. They can't give Social Security too much information. They need to tell them how this condition affects their ability to work. Most of them have tried to work for a long time before they had to finally give up. Mm-hmm. How did that process work? What did it keep you from doing? Did coworkers have to help you with certain tasks because you could no longer do it? Did the employer feel a loyalty to you and let you stay on the job even though you couldn't do it? All that information that's not in the medical records. Does the medication cause side effects? That can be considered in the decision too. And also they need to tell Social Security everything that's wrong with them, even if it's something minor, because there's a concept called combination of impairments. Somebody can have, for example, 3 different diagnoses, any one of which by themselves is not severe enough to keep them from working. Having the combination could. So even if they have something minor, they'll need to tell Social Security that.
Yeah,
and Social Security tries to get that information from them with the forms that they have them fill out. People tell me, well, they asked the same question 5 different ways. And I said, yeah, they use focus groups for these. They found out the first 4 times you did get information, the 5th time you finally gave them the information they're looking for.
Yeah.
Because Social Security doesn't want somebody to have to appeal. First of all, it's the right thing. If they meet the requirements, pay them as soon as possible. But second, they don't have, that's time wasted that they could be using to process other applications if somebody's processing an appeal when they really are disabled.
Right. So would it be right to talk to your doctor and let them know that you're applying for Social Security benefits?
In one very important part, let them know, because Social Security is going to ask for their medical records.
Okay.
And if the file's this big, they might not want to copy it all right away, but if you tell the doctor you're applying, he'll maybe tell his staff that look out for this and get this record to Social Security right away.
Right. And if the doctors, let's say that you've been to, and in that case, if you're disabled, you've probably been to, a dozen different doctors.
Right.
And they can charge for medical records when you call the office directly. However, if you're applying for Social Security disability, I think there's a waiver.
Yeah, they don't. They usually don't charge at all because they're trying to help the person out. And a lot of times the records are digital now, so it's just a matter of pushing a button.
Right.
But they may still have some paper records that they have to be copied.
Yeah. So usually I think it's part of the Social Security Act. I think that they can't charge you for medical records if you're applying. So.
And apply as soon as possible, because at the best of times it's a lengthy process to get the medical records, make that decision. So apply as soon as possible if you need to apply for disability benefits.
Right.
And give them as much information as possible. Write them a book is what I tell people. You can't give them too much information.
Up front. Okay. Yeah. And I think that's probably the most reason that people get denied is a lack of information.
It is. You got to give Social Security enough information to make a good decision. But if you meet the requirements they want to allow you at the start, they don't want you to have to appeal. Yeah, very, very good to know. And then in that, one thing that comes about, sometimes children are disabled and maybe young enough that they never paid into Social Security. So are there any benefits for them? Right. Well, there's a program. It's not Social Security, but Social Security administers this program. It's called Supplemental Security Income. Okay. SSI for short, but that stands for Supplemental Security Income. It's not Social Security. It's not paid for with Social Security taxes, but is administered by the Social Security offices. And it's for people who have low income and low assets who are either over 65 or disabled. Now, children can receive those benefits, but if they're living with the parents' income can affect that because it is based on need. And so a typical middle-class family very likely has too much income for that child to receive SSI. However, the parent's income only affects the child when they're under age 18.
Okay.
So at age 18, they look at the child's income only. And so a lot of children become eligible have disabilities become eligible at age 18 for SSI. And it's very important that that person not have income and assets in their own name. So if you do have a child with disabilities and you have too much income while they're under age 18 to receive, you want to make sure that you don't give them money that's going to keep them from getting SSI. Right. Now, SSI is a check, but that's not the most important part of SSI. The most important part of SSI is in the state of Texas, any month somebody is eligible for an SSI check, the state gives them Medicaid. And that's what you want to keep that child eligible for is that Medicaid, which comes along with the SSI check. So if you have a child with disabilities, then you need to do some planning. You need to set up a special needs trust.
That's right.
So that if you pass away, the money that child might inherit doesn't go to them directly, but to that special needs trust, a properly set up one, so it doesn't count as assets to that child or income to that child.
Right. There's a lot of planning and structuring that can be done, working with a special needs trust attorney, They're accustomed to setting that up, and that way it doesn't discount them for benefits. It also can appoint someone to manage those assets for that disabled person. And then I think one of the biggest concerns of parents is, I'm here to take care of my child, but what happens if we're not here? And so a lot of times a joint lifetime policy or life insurance policy that can then fund the rest of what would be needed in that trust is really important. Yeah.
And a lot of times a group home might be the best living situation for that person. Well, they're usually Medicaid facilities. If they're not on Medicaid, they may not be able to live there. And so that's part of that whole process. And with parents when I worked at Social Security, I'd speak to a lot of groups of disabled for children with disabilities.
Yeah.
And parents would ask me, when should I do that planning process? My answer was yesterday.
Yeah, for sure.
You need to do it as early as possible because you have no idea what might happen. Both parents might get killed in an automobile accident tomorrow. If they haven't done the special needs trust, that money's going to go to that child. They can't stop that from happening. The child's going to inherit their share of that estate.
Right.
Could knock them off of SSI Medicaid. Tragic situation in Tarrant County. This was several years ago. The parents did everything right, but this person was about 40 years old, had been disabled since birth. He had been living in this group home for 20 years. That was his home, a Medicaid facility. The parents did everything right, set up a special needs trust, but they didn't notify the extended family about the need to have any money go to that special needs trust. And uncle passed away and thought he was doing a favor for his disabled nephew and left him like $150,000. Knocked him off SSI, knocked him off Medicaid. He had to leave the group home, which was his home. Since he had no longer had Medicaid, he had very expensive medical problems. That $150,000 spent in medical costs just like that. So he's back on SSI real soon, but at that time there was like a 7-year waiting period for those group homes.
Yeah.
So
that's unfortunate.
Not only do the parents need to do the thing right, they need to tell the extended family, do not leave this child any money unless you lead it to the special needs trust.
Right. And I think that's a good case in point of working with a financial planner that understands the situation.
That's right.
I would say we kind of play quarterback when it's coordinating all these benefits and attorneys and family and all of the above.
That's right. You get them in touch with the proper people to do it right. And they need to do it right. They need to talk to an attorney who knows what they're doing with those. Yeah,
absolutely. So those are needs-based benefits, SSI, Medicaid. However, if there's a child that was disabled prior to the age of 22, there's disabled adult child benefits. Talk to me about how that works and where that can come into play, because a lot of our clients that are high income earners, their kids don't qualify for Medicaid benefits. It's not needs based. There are still benefits available.
That's right. Most people know that if a parent passes away, if they have children under age 18, the kids draw a check till they turn 18 or up to 19 if they're still in high school. But also, when a parent passes away or starts receiving Social Security benefits, if they have a child who became disabled before age 22 and who is still disabled and unmarried, that child receives a check just like they were under age 18, as if they're under age 18. And that's called a disabled adult children's benefit. And so they draw that for the rest of their life, as long as they remain unmarried and disabled. Not based on need. They get Medicare after receiving that benefit for 2 years, because people receive a disability check, receive Medicare after 2 years.
So Medicare, not Medicaid.
That's right. And Medicare, not Medicaid. Medicare is not based on need. It's the health insurance for people over 65 in general, but also people who are on disability for 2 years get Medicare. And so they'd qualify for that. Now, if they were drawing SSI before and had Medicaid before they started drawing the parent's record, as long as they would still draw the SSI check if they weren't drawing that Social Security check, they get to keep their Medicaid. So that's important. But now that Social Security, now that Medicare has prescription drugs benefit, it's not as important to stay on Medicaid as it used to be, but it still is very helpful if they can stay on Medicaid.
Okay.
But now they've got Medicare Part D for prescriptions. It's not as vital they stay on Medicaid, but still, if you have a child with disabilities turning age 18 and the parents aren't deceased or drawing their Social Security yet, I'd encourage them to get them qualified for SSI, set up the special needs trust and everything to get them Medicaid. Then once they start drawing the Social Security check, when the parent starts drawing the Social Security, for example, that may stop the SSI, but if they get to keep the Medicaid, then the state will pay their premium for Medicare Part B, which is doctor's insurance. They'll qualify for Part D at no cost at all. So it's still important even for those children to become eligible for SSI at age 18 if they can.
Yeah. So for that child to be eligible, the parent has to be drawing their benefit or have filed for their benefit?
Or be deceased.
or be deceased.
Yes, yes.
But they could file and defer their retirement benefit, and would that help them?
No,
or
they can't draw a check any month. The wager's not drawing checks. So
they have to draw their check.
Yeah,
Okay.
right. There used to be something called file and suspend, but that was actually not intended in the law.
Okay.
So that's gone.
Okay.
That's one change that did happen in Social Security is they
Yeah.
fixed an error there.
Yeah.
But no, they have to, the parent has to actually be drawing the check for the child to draw.
That's always been a question. Like, do I have to draw my check or just kind
Yeah.
of file and wait?
Right, they have to draw.
That really helps to have that clarified.
Yeah,
So
yeah.
that's a good part of the strategy. So yeah, really important. Retirement benefits, disability benefits. We've talked a little bit about widower benefits, and now the fun topic, Medicare. Maybe we can kind of do a little bit more of a dive into
Right,
Medicare and how that works. So I guess kind of give me an overview of
Okay.
how that's structured.
Well, between the two programs, in my opinion, Medicare is far more important than Social Security because Social Security is money, and money's important. There's a lot of ways you can get cash. You can work longer for retirement. You can cash in investments. But Medicare gives us something we simply cannot get anywhere else, and that's health care insurance that pays first once we're 65 and over and retired from where we have our health insurance. Basically, when we turn 65, we're uninsurable. You can't expect private insurance companies to sell us health insurance that pays first at a price we can afford when we're uninsurable because they'd all go bankrupt if they had to because there's
Yeah.
70 million of us on Medicare,
At
right?
65.
And so what Medicare means is we still have access to health care after age 65. That's worth more than money. You can't put a dollar figure on that. So that's why I say Medicare is more important. And Medicare's age is still 65, has not gone up.
And that's for everybody regardless.
That's right, hasn't gone up.
Yeah.
No matter what your full retirement age is for Social Security, Medicare is a separate program. Its age is still 65. The two basic parts of Medicare are Medicare Part A, Medicare Part B. Part A is the hospital inpatient insurance. It pays the hospital bill itself when we're in the hospital. People say Part A is free, but it's not. We pay for it while we're working, so we don't have to pay for that once we are retired. A small part of the FICA tax we pay when we work pays for Part A.
Yeah.
So as long as somebody qualifies to receive a Social Security check based on their own work or their spouse's work, even if they're not drawing the check yet, Part A won't cost them anything.
Okay. I always say it's not free. It's just prepaid.
That's right, exactly, prepaid.
Like everything else.
Yeah.
There's no free lunch.
There's nothing free. It's prepaid, like you said.
Yeah.
Now, Part B, which is the doctors and outpatient treatment. And when I say Part B covers doctor bills, that's all doctor bills. Some people get confused. They think the doctor bills you get in the hospital, Part A is going to cover, but no. Part A only covers the hospital bill itself when you're an inpatient. All the doctors you saw and all the ones you didn't see, their bills are covered by Part B. So in and out of the hospital, Part B covers doctor bills and outpatient treatment. It's the one that has a monthly premium. For most people, that's $164 a month. That $164 is only 1/4 the cost of the premium, though. The federal government pays the other 3/4. So every month somebody pays $164 for the Part B, the government pays $492 for the Part B. We pay 1/4, the government pays 3/4. Now, if somebody has income above $97,000 for an individual or $194,000 for a couple, they don't get the full 75% subsidy, so they pay more than 1/4 the cost. It's a sliding scale, so how much more they pay depends on how much income's above. $97,000 for an individual, $194,000 for a couple. But here's the issue. Social Security has no idea how much income somebody has this year or even last year.
Right.
So they have to base that higher premium on income 2 years before. So here in 2023, it's based on 2021 income, next year on 2021 income, so on. But if somebody's income has gone down in the last 2 years because they retired or became widowed, they can ask to base that premium on the current income, not 2 years ago. So, if somebody has good jobs, they retire, they file for the Part B, get a letter saying you have to pay this pay a premium. If income gone down because of retirement, they need to contact Social Security and tell them.
Okay. I was going to say, how do they do that? They just call Social
Call Social
Security.
Security and they'll probably have them, just something from their employer say they retired or something like that for evidence. Is all
Are
they're
you
gonna
saying you call Social Security or call Medicare?
You call Social Security. Social Security does the entitlement part of Medicare, and that's part of the entitlement part. You call Social Security for that.
Okay, that's helpful.
Yeah. The Social Security is a contractor. Medicare pays them to do the entitlement and the premiums, that kind of thing.
Okay.
Social Security's not involved in the medical-ish part of it, what they cover and things like that. So they call Social Security and tell them, my income's gone down because of retirement.
Okay.
There's a few reasons. If your income has gone down since 2 years ago, that you don't have to pay the higher premium. They call them life-changing events.
Okay.
The most common of those are retirement or becoming a widow, but there are a few others. They list all of them in the letter that you get, saying you have to pay the higher premium, saying always just check to see if something else might apply.
Yeah.
Otherwise, they might have to pay the higher premium for the.
Okay. So you got Part A, hospitalization. Part B, I think of that as like the typical 80/20 insurance, and that's that portion.
And you need to have Part B in place when Medicare's primary. Anytime Medicare pays first, you got to have Part B in place, because once Medicare's primary, nobody else pays anything Medicare to pay for. The only time you don't need Part B, the only time Medicare's not primary, is if when you turn 65, you're covered by for health insurance, you're covered by your or your spouse's active employment for an employer of 20 or more employees. Okay. So when you turn 65 and you're still working for an employer of 20 or more employees, you're covered by that employer's health insurance as an active employee. Then while you're still working past 65, that employer's insurance has to pay first, Medicare pays second. Medicare does not force you to pay for Part B as secondary coverage. So in that situation, they can wait till they retire, get their Part B right away, there'll be no penalty. It's called a special enrollment period.
Okay.
Every other situation, though, Medicare's primary, you got to have Part A and B in place once you turn 65 in every other situation.
Yeah. And there's a lot of misinformation about that as well. I remember a client asking me, talked to Social Security. They said, I earned too much this year. I have to wait till January to retire. I was like, no. That's not how it works. There's, a special enrollment period, and there's also exceptions to that in the year in which you retire.
That's right. Yeah. For example, going back to Social Security, for example, there is a limit on your earnings if you're younger than full retirement age. But the first year that you retire, you can receive a check for each month you're not working, no matter how much you made before you retire that year. For example, let's say somebody was 63 years old, they're going to retire September 30th, not going to work in October, November, December. Since that's the first year retirement, they can draw a check for October, November, December, no matter how much they earned before they retired that year. Only applies to that 1 year, though.
Right.
But a special rule to let somebody retire without penalizing for the work they've already done that year.
So they can do that year. And then, so that's for Social Security benefits. And then for Medicare, they miss the enrollment period, and I know that confuses a lot of people.
Right.
So in that year in which you retire, what's the rule there?
Okay, so let's say somebody didn't take Medicare Part B because they shouldn't have, because they're covered by their active employment from 20 more people. And so let's say they're 68 years old right now, and they're going to retire from that employer. They're going to retire in September, for example. Medicare becomes primary the month after retirement when it's been secondary like that. So if they retired at age 68 in September, Medicare would become primary October 1st. As long as they apply for Part B before the end of October, the month after retirement, it would be retroactive back to October 1st. There'd be no gap in coverage.
Okay.
I'd encourage them to contact Social Security 3 months before retirement to file for the Part B, to give them time to get your new card to you showing you have Part B by the time Medicare's primary.
Okay.
But the very latest, when you work past 65 like that and Medicare's secondary, be sure to file for Part B before the end of the month after retirement to not have a gap in coverage. And you can see I kind of stress that, and that's because if you read a pamphlet about this later, it's going to say that special enrollment period to file for Part B lasts for 8 months. But I don't believe that, because I don't believe I have 1 second's gap in coverage. If somebody retired at age 68 in September and waited till November, the second month, 8-month period to file for Part B, it wouldn't start till December 1st. They'd have 2 whole months without any coverage for doctor bills.
No coverage.
I'd be afraid to get out of bed if that was me, right?
Yeah,
So,
you don't want to miss that.
Yeah, so if you do work past 65 like that for Medicare secondary, be sure and file for Part B at the very latest before the end of the month after retirement, so you won't have a gap in coverage.
Yeah, that's really good advice. Yep.
Yeah.
That's good.
And so you always want secondary coverage to Medicare, because Medicare pays about 8% of the hospital and doctor bills, like a lot of insurances.
Like 80%.
Yeah,
so
like
then,
80-20, There's
Right.
a lot of insurances like that. But this is the thing, as we get older and the total bills get higher, that 20% can be a whole lot of dollars, right?
Sure.
You'd be amazed how many people I talk to that Medicare pays $1.5 million to $2 million in hospital and doctor bills in 1 year for one person. So if Medicare paid $2 million in one year in hospital and doctor bills, that means it didn't pay over $400,000.
Right.
Which to me is still a lot of dollars.
That's a lot of
And
dollars.
so that's why you want that secondary coverage to protect you, because that catastrophic type health event happens more often than people realize.
Yeah.
Plus, it doesn't have to be that catastrophic. It can still be a lot of money.
Still be a lot of money.
Yeah,
That's
so you
right.
do want
Yeah.
secondary coverage, so you can go with what they call original Medicare, which means there's no network. You go to any doctor, accepts Medicare anytime you choose. Medicare pays first. You buy something called a Medigap insurance policy from the insurance company, pays second. Or you can join something called a Medicare Advantage plan. It's like a Medicare HMO. You have a network, you have to stay within that network normally. If you go with that, the way that controls out-of-pocket cost is in a Medicare Advantage plan, you have a set copay for hospital stays and doctor visits.
Okay.
And they also have an out-of-pocket maximum. So you give up choice, so you have to stay within their network with that.
What are the considerations there? Should they pick is it a Part C plan, which is a
Part C is Medicare Advantage. Yeah, that's
Medicare
the main
Advantage,
one.
or should you do the traditional Medicare plan?
Well, I guess it depends on, you're going to pay more for choice. You stay at the original Medicare, you have to buy that Medigap plan. They're not all that expensive.
Okay.
So you're paying a little more for choice there, because here in the DFW area, most Medicare Advantage plans have no premium because there's so much competition. It's a huge metro area here.
So you can save some money.
Yeah. So if you know, I'm not saying one's better than the other, because it depends on your situation. Do you want choice?
Yeah.
And of course, the Medicare Advantage plans, it pays them to keep you healthy. So they offer some things that regular insurance and Medicare doesn't cover, like some dental and vision coverage.
Right.
So you give up choice because you have to stay within the network, but you have some advantages there. So it's really what the person desires. If somebody wants help in picking the best plans for them, Medicare has trained people and all the rules. They work for nonprofit agencies. Medicare pays these nonprofit agencies to have these people out there to provide at no cost to us help with that Medicare planning.
Okay.
They can help somebody decide whether to go with the original Medicare or Medicare Advantage. Once they make that decision, help them pick the best plan. And they usually work for your local area agency on aging. But really the easiest way is just remember 211.
Okay.
Everybody knows what 911 is, right?
Sure.
211 has been around a long time, but people still aren't aware of it very much. But it's not a Medicare number. It's for any social service information. So when the time comes, they can just dial 211, tell them, I want help with Medicare planning. They'll get them in touch with Medicare trained professionals to help them decide which way to go and help them pick their plans. They do a great job. They're really very well trained.
Oh, that's great. That's a great resource. So 211.
211 and say, I need help with Medicare planning, and they'll get you in touch with those people. Yeah.
Yeah. I remember when 911 was new, and it was like, hey, when you have an emergency, call 911. There was a Cowboys commercial. And they're like, when I'm in trouble, I dial number 88. It's Michael Irvin at the time. And he goes, when you're in trouble, dial 911. So
that's a good one. You remembered all these years.
That's right. It was a good commercial.
That's how you measure the success of a commercial. 30 years later, you still remember.
Do you remember it? Yeah. So, hey, when you're signed up for Medicare, it's 211.
Just don't dial 88 when you have an emergency.
Yeah, exactly. No, that's really, really helpful. And then you have the Part D, which is, the prescription drugs, right?
And they could, the same people, they can help you pick your best Part D plan. And this is the thing, you can do this yourself at Medicare.gov, Medicare.gov's Medicare's website. They have something called a plan finder, but I a lot of times I don't refer people to it because there's a lot of operator error in that, because it's complicated. This is the thing, this complicated modern world is a world of experts. Everybody knows one little sliver, and that's all they know. All I know is Social Security and Medicare. Don't ask me about anything else because I don't know, right?
Okay.
So they have to rely on you because you're the expert in financial planning. Everybody's an expert in one thing. Well, the people who do this for Medicare are the experts in that. So why not use the best people with the best knowledge, the experts?
Okay. So same resource, that 211.
That's right.
And go that route.
Yeah.
Okay.
They do that all day, every day. So they're the ones who know it the best.
All right. So I don't want to end without asking the question that I think is in a lot of our clients' mind. They're worried about we call them the next generation of our clients, right? So we have a next gen program. It's educating, the kids of our clients. We're beginning to work with, younger and younger clients and getting them ready for retirement.
That's great.
And they really even need that. And I think our clients are concerned because they're looking at it going, I have a pension plan and my son or daughter does not. It's going to require a lot more planning, and they have to be much more on it.
Absolutely.
To be prepared to be retired. And then they worry about Social Security and these types of benefits. They're going, well, they're paying into benefits and Social Security may not be there, right? That's always, that's the word that's out there. Talk to me about that. Should they be concerned?
Social Security cannot go away. There's no way. And actually, it's more important for the next generation because that's their only guaranteed income. They don't have the pensions, right?
That's right.
So it's their only guaranteed income. It's even more important for the future generations who don't have the pensions at all. But people think if Social Security went away, it only affect people on Social Security. It would affect almost everybody because almost everybody's paycheck depends on Social Security money getting spent. Here in Texas, Social Security pays over $7 billion a month in benefits. Just in Texas, Social Security
$7
pays
billion
over
a month.
$7 billion a month.
Wow.
And almost every penny of that gets spent. Because if you're 80 years old, are you saving for anything? No. You're spending that check that's coming next month and next month. How many jobs does $7 billion a month being spent turn into in the state of Texas?
Right.
I used to tell people I always Social Security money was a different color. When they got their paycheck, they didn't realize how much they rely on Social Security, right?
Yeah.
In their paycheck, if you next time you go to a restaurant, look around and see how many people are clearly drawing Social Security in that restaurant, right? Mm-hmm. Next time you go to fly airplane, I fly all over the country speaking at seminars. I made a habit of looking to see who's getting on the plane with me. Almost every time, at least half the people are clearly on Social Security. So if you work for an airline, half your paycheck's coming from Social Security.
Yeah.
It would be the worst depression we ever had if those checks didn't go out next month. Right. So for that reason, no Congress can let that happen.
Yeah.
The human cost will be tremendous. About 250,000 people in the Metroplex, Social Security is virtually their only income. Mm-hmm. So if those checks didn't go out next month, you'd have an additional 250,000 potentially homeless people. But most of them wouldn't become homeless. You know why? Because they'd move in with you. And when people tell me Social Security is going to go away now, that's what I tell them. Don't downsize when you retire then, because if Social Security goes away, you're going to need an extra bedroom for mom and one for grandma.
Yeah, yeah.
So
and I think you've always said that, really, Social Security is just not an optional program.
Absolutely not, yeah.
It would just become a welfare program at that point.
And you see how
so
popular those are, right?
It's a necessity.
Yeah,
right?
That's right. And the thing is, Social Security polls, and they've been taken every year Social Security started, in every age group, Social Security is more popular than defending the country. Mm-hmm. I can't even say that, but in most people support Social Security than support the armed forces. And the armed forces borrow money every day to survive.
Yeah.
Social Security's never borrowed down from anybody. Nobody says the Army's going away, right? And it's not, but neither is Social Security. It's not an optional program at all. Neither is Medicare.
That's a good point. Well, that helps, and hopefully it helps people sleep a little bit better, not worrying about that system.
So don't take your Social Security early just because you think it's going to go away, because that's not a good reason to take it. There may be a good reason to take it early, but that's not it.
Right. Well, Tom, thanks for being here.
Thanks for having me.
And a lot of information in a short period of time. That's great. Thanks for tuning in for this webinar about Social Security and Medicare. Stay tuned for our upcoming webinars. We're going to talk about property insurance and a full gamut of financial planning topics to help educate and get great expert information directly to you. Thanks for tuning in.